Blanca and I'm a radiography student, and today I will be demonstrating on how to do 4 projections of the shoulder. My first projection that I will be starting off will be my AP shoulder with internal rotation. But before that, before getting my patient, I want to make sure I have my room set up. I have already set up my console to my wall bucky, and next I'll be detenting my x-ray tube to my wall bucky. I'm going to bring this around. Once I have that there, then I'll be angling my tube to a 90-degree angle. Angling to 90 degrees. And then next, making sure that I have my R in here, which is already in place, and it's in a landscape orientation, and it's a 10 by 12. Take that back in there. Next, I'll be getting my patient. And I have my shield here ready to go as well. Hi, my name is Blanca. I'm a radiography student, and today I will be doing the exam for you today. Okay. And can I have your full name, please?
Yes, Miriam Garcia.
And your date of birth?
August 23rd, 1993.
Okay. And what brings you here?
I fell a couple of days ago.
Okay, and from my understanding, it's your right shoulder.
Oh,
right?
yes, it's my right shoulder.
All right, do you have a lot of pain right now, or
I'm okay.
have you had any previous surgeries?
No.
And is there any possibility you might be pregnant?
No.
Okay, so just really quick, are you able to extend your arm out?
Yes.
Yeah, okay. So go ahead and you can follow me, but first of all, I want to shield you, so I will be placing this. You can hold that for me there. Thank you. So you can come around and you can stand here. So you're going to be facing towards my x-ray tube. And another thing is our central ray is going to be 1 inch below the coracoid process. So I'm going to go ahead and still move my patient a little bit towards their left side. And that will be fine there. And then also, ma'am, I'm going to ask you if, since we're doing our internal, first the internal rotation, I'm going to ask if you could, the back of your hand, if you're able to put it towards your side. So once we have that there, then I'm going to put my marker. And then just making sure that my tube is aligned to my wall bucky, which in the situation it is. Okay, ma'am. So just go ahead and follow my breathing instructions. Stay still, don't move. Okay. Take a deep breath in and hold it. Breathe, x-ray. You could breathe now. So my technique for this first projection, it was 85 kVp at 10 mass. So next I'm moving forward with my AP shoulder with external rotation. So the only change I'm going to be making here is having my patient extend their arm out. So you can go ahead and open it up, and it's going to be, the hand is going to be supinated. That's fine there. Another thing, making sure, remember to remove your IR. I've gotten a new IR, I'm placing it back in. Same orientation. So ma'am, if you could stay in that same position you're in, making sure she's there. Her chin is towards the left side. Follow my breathing instructions, please. Take a deep breath in and hold it. Breathe, x-ray. Thank you. You could breathe now. And our technique for this, you could go ahead and put your hand down. Our technique, it was 85 kVp at 10 mass. Okay, so now for our next projection is going to be an PA oblique, which is known as the Y view. And for this, I'm going to ask my patient to face towards the wall bucky. So go ahead and face the wall bucky, and I will be turning my shield around. There you go. So you could stay facing forward, and for this, our center ray is going to be it's going to be perpendicular to the scapulohumeral joint. But first of all, before we do that, we want to make sure that we rotate our patient approximately 45 to 60 rotation. So if I could go ahead and rotate you, making sure that our scapula is perpendicular to the IR. A little bit more. So once we have that there, I'm going to place my marker. Place that there, just making sure. Okay, so once we have that there, another thing for this one, you do have to change your IR. It's a portrait orientation. Okay, so once we have that ready to go, ma'am, if you could follow my breathing instruction, take a deep breath in and hold it. Beep, X-ray. And our technique for this was 85 kVp at 18 mass. And you could breathe. I'm sorry for having you hold it longer than you should. And technique is 85 kVp at 18 mass. So after this is done, we will proceed. So for our final projection, we're going to be doing our superior inferior axial projection. And we're going to have our patient have a seat on the chair. So Ms. Garcia, if you could go ahead and sit down. Next, I will be placing a shield on her lap. So you could go ahead and hold that there. Also, I'm using a 10 by 12 IR, and also my console has changed to tabletop. So I'm going to place that here. And Ms. Garcia, if you could go ahead and extend your arm out. Go ahead and place it. There you go. So making sure that the hand is in prone position, and also our elbow is at a 90-degree angle. So once we have that there, then our center ray is going to be 5 to 15 degrees, 5 to 15 degrees towards the elbow and at the shoulder joint. And Ms. Garcia, if you could move your head towards your left side. Tilt your head, please. Okay. Making sure that our SID is at 40 degrees. And then again, placing my marker. So Ms. Garcia, just stay still, hold your breath. Beep, X-ray. You could breathe now. You could relax. And my technique for this projection was done at 75 and 75 kVp and around 5 to 8 mass. And this concludes our 4 projections of the shoulder. Thank you. The evaluation criteria for the AP shoulder with internal rotation consists of the lesser tubercle in profile and pointing medially, which you could see here. Also, the outline of the greater tubercle superimposing the humeral head, which you could see here. And then the last thing would be the greater amount of humeral overlap of the glenoid cavity. So we could see here that it's overlapping the glenoid cavity of the humeral head. For the second projection, which was the AP shoulder with external rotation, the evaluation criteria is the humeral head in profile. Let's see here. Also, the greater tubercle in profile on lateral aspect of the humerus, which is up here. And then as well as the scapulohumeral joint visualized with a slight overlap of humeral head on the glenoid cavity, which we could see here. And it's overlapping the glenoid cavity. And finally, it would be the outline of lesser tubercle between the humeral head and greater tubercle. Right here. The evaluation criteria for our third projection, which was the AP oblique, also known as the Y view, consists of the humeral shaft and scapular body superimposed. Also, no superimposition of the scapular body over the bony thorax. Another thing will be the cranium projected laterally and free of superimposition, and the scapula and lateral profile with lateral invertible borders superimposed, as we could see within the image. And finally, just checking for soft tissues and bony trabecular detail. The evaluation criteria for the last projection of the shoulder, which was the superior inferior axial projection. The evaluation criteria is checking for evidence of proper collimation. Also, the scapulohumeral joint, which we could see here. And the coracoid process projected above the clavicle, which you could see here. As well as the lesser tubercle in profile, which is there. And the AC joint through the humeral head, which we could see here. The AC joint coming down through the humeral head. And finally, just checking for soft tissue in the axilla with bony trabecular detail. So that could be seen in general and within the image. And this concludes the evaluation criteria for the 4 projections that were done of the shoulder.